Namaskar viewers, under health question series, another very known or common disease area we are going to talk, and surprisingly, this is very common in adolescent or teenage group child. So worrisome factor, and cause is not yet known, but let us see how to address it. And it is one kind of a very unfortunate incident that is called sarcoma or cancer tumor, and that happens in the bone region especially. And that's the reason we thought we will talk to the oncologist who can give us the in and out about this, also the treatment course and other details. So Dr. Abhijit Salunke once again with us. Doctor, welcome and thank you for your time.
Thank you.
uh, Doctor, what is osteosarcoma, if you want to define?
So osteosarcoma, we can define it's a primary bone tumor which
Hmm?
occurs in bones most commonly. Rarely it can occur in soft tissues also, and it's most common pediatric bone tumor.
Hmm. And
Pediatric bone tumor.
which bones, especially any particular region?
We can say most common is femur,
Huh?
means around the knee joint. We can say
Yes, yes.
knee joint is most common location. Distal femur or proximal tibia below the knee, above the knee.
Okay,
We can say that is most common.
okay,
And shoulder region, humerus. That
okay.
is the next common bone. So
Okay.
most common region is around knee and
Huh.
around shoulder.
On
So
our
we can
shoulder.
say that. And it's most common pediatric malignant bone tumor. Means a bone tumor which has chances to spread at other parts of body. So it's called malignant and occurs in more common in pediatric age group. So
Correct.
elderly it can occur, but less common, more common in age second decade of life,
Hmm.
first and second decade of life.
Hmm.
That is it.
Any cause which we can say this is the reason, or there is no reason?
We don't know exactly. There are multiple syndromes which can be associated with it,
Hmm.
but there is no exact cause that why it occurs, and the exact etiology we don't know
Hmm.
really now.
Hmm. 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 Okay.
There are few syndromes. So
Huh.
we in the subsequent part of lecture we'll see what are the syndromes which are common, which
Sure.
may be due to mutations or other things, but exact etiology is very less commonly known,
Hmm.
and it's very premature knowledge for us
Hmm. Hmm.
about these tumors.
Hmm. But unfortunately, it is quite common and it is largely found nowadays. Also, according to your experience, is it any data or statement which will say is it more in boys or girls?
So more common in boys, less
Okay,
common in girls. So worldwide data is same. More
okay,
common in boys, more less common in girls. And age group we can say second decade of life,
okay,
first and second. So less than 20 years age group.
okay. So let's say 13 to 20 years of age group is.
10 to
Huh,
20 you can say most common age group,
okay,
and more common in boys as compared to girls.
boys.
And
Okay.
we go to the US data,
Uh-huh.
then more common the blacks as compared to the whites. We
Okay.
can say.
Hmm. Can we
So
relate it?
Indian division,
Uh,
Indian data, Indian race data we don't have, but US data they have that more common in blacks as compared to white. So they say it's more common in blacks.
is it something to do with eating habits or lifestyle?
No, we don't think so.
We
That
don't think so.
we
Okay.
have any reason that we can conclude it any cause is there
Okay.
about food or any factors. So
Okay. Okay.
not possible to comment on it.
All right. So, doctor, if we can see some visuals or some sort of
Yes,
images.
so we can show you basic pictures what we can which can be useful for the audience.
Hmm,
Then
hmm,
there are two types of bone tumors commonly.
hmm,
One is benign,
hmm,
which has less chance of spreading to other part of body, and
hmm,
second is malignant. So
hmm,
first we can say osteosarcoma, second
hmm.
Ewing sarcoma, and chondrosarcoma.
Okay.
So what we discussed today is osteosarcoma.
Yes.
So from which part of the bone or from where it arises,
Hmm.
that we know. So it's a osteoid producing, means bone producing cells are there, and they lead to formation of these tumors.
Okay.
So that is the primary etiology of these
Hmm,
tumors.
hmm,
So if we go to the worldwide data,
hmm.
you can see how less bone tumors are.
Correct.
Most common are lungs, second can be breast, or third can be breast, we can say.
Yes.
And the incidence is very less, 8.7 per million. Of lungs is 610, breast is 633 per million, but bone is quite less. And in pediatric age group, what age group we want to see today? is it's 8 most common tumor in pediatric age group.
Hmm.
8 common. So
Hmm.
first is leukemia,
Hmm.
blood cancer, what we
Yes.
say
Yes. Yes.
commonly. That
Yes.
is more common in pediatric age
Multiple
group.
sclerosis
And of bone tumor, osteosarcoma is the first.
first.
First, yeah. So more common in blacks as
Hmm.
compared to white, and what we say with males more
Hmm.
common as compared to females.
Hmm.
Age group is less than 20 years age group,
Hmm.
and more in males as compared to females. Secondly, it can be seen in elderlies more than 65 age group.
Okay,
That
I
is
see.
the age group.
What my observation is, a layman observation, I would say, at the time of growth or at the time of decay is where
Yeah.
it is happening, is
Yes,
what.
so at time of growth, it is more growth
Ah,
spurt is there.
hmm.
So that age group is more common for these tumors
Hmm.
because it's a growing part of the bone,
Hmm.
and
Hmm.
we can say that is the most common part where these tumors occur.
Correct. Hmm.
These are the cells which it differentiates. So
Hmm.
bone forming cells are there,
Hmm.
which leads to formation of these tumors.
Hmm.
And we should know the basic classification. As
Hmm.
a person,
Hmm.
there are two types of tumors. One is high grade and low grade. So what we see commonly are high grade tumors. Osteosarcoma is commonly high grade tumors.
Okay.
Means chances of spreading to other parts of body are there.
Okay, I see. I see. Huh.
So that is most common. So
And
how we
how is
diagnose
it?
it?
Is it rapid, doctor? Like, let's say.
It's very fast. It's very fast
Oh,
growing.
okay. Okay.
So the symptoms we will see.
Hmm.
So age group is pediatric more common.
Hmm.
These are the syndromes what you said. What are the common etiologies or risk factors? But these are very rare. Less than 1 to 3%. These can be the causes.
I see.
So in majority of cases, we don't know the cause why these occur in the patient.
Hmm. 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 Hmm.
These are the symptoms. What is important for us?
Hmm.
If the person has pain, which
Hmm.
is of short duration history, which is constant, dull aching, very less relieved by painkillers, analgesics, swelling, which is growing very fast, with
Hmm.
symptoms of 2 to 3 months duration.
Hmm.
These are the alarming signs, and you should consult your doctor
Hmm.
for pain and
Hmm.
swelling or any part of the body. You consult your doctor.
Okay.
Fracture, because the bone is weak, it can get broken. There
Hmm.
can be limitation of movements,
Hmm.
and if it has spread to other body parts, you can have chances of cough and weight loss if it spread to the lungs. A bit bad for the patient. So, as a person, we should know that if it's pain and swelling, short duration, consult the doctor earliest possible. Get a X-ray done or some investigations. That will be more important for
The
us.
first stage of diagnosis X-ray.
Yeah, first so these are the common locations
Ah.
uh, around the knee.
Hmm.
So green is around the knee,
Hmm.
distal part of the femur,
Hmm.
and proximal tibia.
Hmm.
And third more common site is around the shoulder, proximal humerus.
Hmm.
All other locations it can occur in the chest wall, in the pelvis, in the other parts. It can occur in mandibles also,
Okay.
jawbone also,
I
but
see.
less likely. So
Yes, ma'am.
most common locations, any swelling around the knee joint,
Hmm.
you should consult your doctor, or swelling around the shoulder. It's better to consult a doctor. These are common locations of osteosarcoma.
Okay.
And how the doctor evaluates the patient?
Hmm.
He clinically examines him, gets a X-ray done, gets basic blood test done, followed by MRI,
Hmm.
followed by other workup like biopsy and other
Oh,
things.
X-ray also. Okay.
Yeah, so this is the thing how the patient presents to a doctor. Any swelling, so in this case, it was swelling around the wrist joint.
Ah.
He got an X-ray done,
Oh.
and the doctor evaluated the X-ray. So this is the classical X-ray of osteosarcoma.
Okay.
So swelling around the knee joint. So we
Yes.
can appreciate the growth plate is open. Growth
Hmm.
plate means there is a fascial line,
Ha ha
which is
ha.
so that is open. So which suggests the child is of young age,
Hmm.
swelling around the knee joint, and
Hmm.
it's very ill defined. You can differentiate where the tumor is starting and where it's ending.
True.
That is important sign for the doctor or the orthopedic surgeon to
Yes.
differentiate
Yes. Yes.
from other bone tumors.
Yes.
First, get the X-ray done.
Huh?
Read the X-ray very properly.
Hmm.
This is one example of X-ray.
Hmm.
This is second example of shoulder X-ray. Again,
Can you
osteosarcoma.
make out the difference between a fracture and a tumor from the X-ray?
Yes, so we can differentiate. Fracture will not have these other components of tumors, like
I see.
it's ill-defined, wide zone of transition. That
Okay.
is not seen in fractures.
Okay.
And these are some X-rays example of shoulder tumor, osteosarcoma.
Huh?
So this is very important. If the doctor sees it's a bone tumor,
Hmm.
better to refer to a center which is treating bone tumors,
Ah,
a cancer center.
right.
So we have made a simple triage method.
Hmm.
If the X-ray looks so simple, green means a
Hmm.
simple tumor, benign tumor,
Hmm.
he can get MRI done, bone biopsy, or other things. But if
Hmm.
he thinks it's a malignant bone tumor, better to refer to a cancer center
Yes.
where all the treatment can be taken in one roof. So
Hmm.
that is very important suggestion.
Okay, doctor, from the layman point of view, when you say biopsy,
Yeah.
uh, is it really painful for the child?
So for child, we do under general anesthesia. So
Okay,
it's
I
just
see.
small, you anesthetize the child.
Okay,
So,
and take the tissues from the affected area.
so this is the MRI, what is done
Ah,
for the patient. So
ah,
after X-ray, you get the MRI done,
ah.
and then the biopsy is done. So we can see here,
Hmm.
biopsy means you make a small incision into the skin, put a needle. So here we can see a needle inside the bone.
Yes, yes.
Yes, so it is under anesthesia. So the child will not have
Will not
pain.
realize it, huh? Hmm.
Yes, so it will not realize it. A
Hmm.
small suture, single suture.
Hmm.
And these are the steps. We can see here a single suture is
Yes,
taken over the thigh
yes,
bone.
yes, 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 yes.
So this is bone biopsy. So no need of to be afraid of biopsy. It is most important step for diagnosis.
So definitely, but what my question is, if you are saying as a common person, what I am trying to understand, when you are taking a small tissue, one prick should be good enough. Why there is a stitches and this much of area required to be cut?
Means no, we are. This is the incision line, final line of incision.
Final life incision. Okay, okay,
Yes.
okay.
So if
I
we
see.
can see, this is the biopsy suture,
Ah,
single suture.
oh, that's all. Okay,
So this is the final line of incision.
okay,
This
okay.
is a single suture which
Ah,
will be required.
ah,
So that is only required and it's less painful.
hmm.
So it is required. It's must for the diagnosis because
Yes,
chemotherapy is based on these.
correct.
So you do the biopsy,
Hmm.
you do the staging workup. Staging means where it has spread. That is very important.
Yes.
It can spread to the lungs, it can spread to the bone. Very common questions by the relatives that what stage we are of the
Hmm.
tumor.
Hmm.
So we need these investigations that can be CT thorax, bone scan, or PET scan. That is latest investigation that is available nowadays.
Hmm.
So after this,
Hmm.
this is the summary what is done. So
Hmm.
get a X-ray done, MRI,
Hmm.
biopsy,
Hmm.
staging workup, then
Hmm.
chemotherapy. So chemotherapy means there are drugs which will kill the tumor cells.
Hmm.
It should be given before and after surgery.
But the surgery has to happen.
Yeah, surgery has to happen. Surgery is the treatment.
Treatment. Okay.
Yeah, so you require before surgery, that is called neoadjuvant chemotherapy.
Mhm.
After surgery is called adjuvant surgery
I didn't how the.
chemotherapy. Yeah, so two types of chemotherapy,
Okay.
before and after surgery.
Okay.
And two treatments are there. One is to save the limb,
Yes.
and second is amputation.
Hmm.
In majority of cases, we try to save the limb.
Right.
That is standard across the world
Right.
now.
Right.
And in very rare cases, you require amputation.
Amputation. But if it is okay, if it is not in lower limb, doctor, if it is
Yeah.
somewhere near the shoulder or upper body, then
Yeah.
in that case,
Yes, any part of the body you require surgery.
no, the surgery is true. But then, for example, collarbone. Then what kind of?
Remove the collarbone.
Oh, I see.
So any bone you can remove it and you can replace if
Yeah.
required. So
Yes.
this is chemotherapy. Why it is given to kill the tumor cells. That is important. So all relatives ask me, is chemotherapy required in osteosarcoma?
Hmm.
Yes, it's required in all high grade osteosarcomas.
Hmm.
Low grade not required.
Hmm.
And low grade are rare tumors.
Hmm.
So all are high grade only. Majority of cases.
Hmm. Hmm. Hmm.
So you require chemotherapy that is must
Hmm.
before surgery.
Hmm.
So next question is duration of chemotherapy.
Ah.
So it's around 10 to 12 weeks. The patient has to come to hospital regularly for all the chemo cycles.
Hmm.
And these are the common drugs which are given. So it's around 10 to 12 weeks chemotherapy.
And uh, uh, the insertion of drugs or medicine for that matter is through the intravenous and not through
Yes,
oral.
intravenous access, or they have nowadays chemotherapy lines are there, port they say. So that catheter can be placed and it will be less painful for the patient then. Chemotherapy catheters are available nowadays.
Available. Okay.
Yes. So
So
again, medical oncologist
all
takes
through
care.
the treatment, the catheters are in the body. I mean,
Yeah, they are placed for in the body for some time,
uh,
means around what is duration of chemotherapy, and then we remove the catheters.
uh,
So this chemotherapy is taken care by our medical oncology friends.
uh,
They give the chemotherapy. So important is the relatives ask why not doing surgery immediately. You diagnose the surgery tumor, and why not surgery? So chemotherapy is required to decrease the tumor load in the body, and it will decrease the size of the tumor. Your surgery becomes more easy. To save
yes,
the limb becomes more easy.
yes, yes,
There are
yes.
micrometastasis, means tumor is spreading all over the body due to its character.
Oh,
So chemotherapy will go in the whole blood, and it
okay.
will kill the tumor cells. So after 10 to 12 weeks, you wait for 1 to 2 weeks, do the surgery for the patient,
Hmm,
and then again chemotherapy is given. So
hmm,
these are the common regimes what are followed. What at our center we give MAP protocol,
hmm,
means high dose methotrexate, cisplatin, and doxorubicin, that is given at our center. Then next is surgery. So
hmm,
two types of surgery.
hmm.
One is removing the tumor completely with
Yes.
saving the limb,
Hmm,
and second is cutting the limb.
hmm.
So if you want to give simple analog, that you want to remove the banana with its covering, and again over the banana's covering you have a plastic covering. So three layers are there. Inside there is banana, there is original natural skin of the banana, and over the natural skin there is a plastic coating. So you have to remove the tumor like a plastic coating. You don't have to see the inner part of banana.
There's the skin or banana
Yeah.
part.
So or a simple orange is there.
Yes,
You remove the orange
yes,
completely with a
yes,
plastic covering around the orange, artificial plastic covering.
yes,
They
yes,
apply nowadays a plastic covering or apple,
yes,
orange, sell
yes.
it. So you remove the tumor that way. You don't have to see the inner part of the tumor. Means the inner part of the orange you don't have to see. With natural covering and a plastic layer. So that is called a wide resection. Easy to understand. It is
Yes,
called wide resection.
yes.
Means tumor with its margin, with its covering, with normal tissue, you
Got it.
remove it.
Got it.
So that is required. You can't remove some part of the tumor, can't keep some part inside the body.
Absolutely.
Again,
No.
it will come back again.
Yes,
So
yes,
that is not recommended.
yes.
And the first aim in cancer surgery is to save the life of the patient, then
Absolutely.
limb of the patient, and the function.
Function.
So always it's important to save the life first.
Definitely. Definitely.
Life matters first, then the limb, and then the limb function.
Absolutely. Yeah.
So these are the staging what commonly are available. Patients ask this question commonly: in which stage we are? First, second, third stage. So two types
Yes.
of stagings are
Yes.
available,
Yes.
and these are the common surgeries. So tumor is occurring commonly around the knee joint. What I said. So
Mm.
most common is around the knee, above upper part of knee or below part of knee.
Mm-hmm.
So you remove the tumor,
Mm.
put these types of joints, what are called megaprosthesis.
Mm. Mm.
You can appreciate your whole femur is replaced. Total
Yes.
femur is replaced.
Yes.
Distal femur is replaced. Proximal femur is replaced. So these are joints are available nowadays. Modular means you can order them and you can get tomorrow. That types of joints are available. If
I
it's
do.
very small age group, then only you need customized joints nowadays.
Yes. Yes.
So that is advantages of recent technology. You
Correct.
have all these joints available on table now. So these are the examples of joint made up of steel
Steve.
or titanium or cobalt chromium material. These are available. You can use 3D printed joints also.
Yes. You
Few
told me.
customized locations.
Yes. You told me.
Customized locations.
Yes. Yes.
Otherwise, you have regular modular joints. These
Yes.
are available. These are the functions how the
Mm.
patient goes
Mm.
after surgery. So they have limitations, but it's excellent function for the patients.
Okay.
These are few examples. You remove the tumor, put cement. You remove the humerus bone. Here, humerus bone is involved. 12 years boy. You have put a plate. These are the tumors which are removed. Put a plate, cement. Again, femur tumor. Remove the bone. Radiate it. Put it back again. That is available. These are functional outcomes. You can replace whole of the bone. So your whole femur is replaced. It's a kid. You can replace a whole bone, and it's a expandable means growing type of.
Growing time. Okay. When the child is
While
growing,
the age group is small,
you can
less than
adjust
12
it.
years, you can do these types of joints,
Yes. Yes.
growing joints, you can
Yes.
say.
Yes. Yes.
Lastly, you have amputation.
Huh.
So this is one type of amputation means rotational plasty,
Yeah.
where ankle joint works as a knee joint.
Oh. And then it is put ulta.
Yes, it is ulta lagate hain, and the ankle works as a knee joint for the
Oh my goodness. Okay.
good for the patient. It's cosmetically not that great, but
Hmm.
functional for procedure. And in
Hmm.
few cases, you can't save the limb, so
I
you have to
know.
do amputation. So
Oh my
that is
goodness. That's
so.
really
Next
scary.
important is how much follow up the patient should have.
Correct.
You have done the surgery, and the patient will say, "I will not come back to you again." That is wrong thing. He has to come to the doctor for every 3 months visit at least for
Hmm.
first few years,
Hmm.
then 6 months, and then yearly they can come.
Hmm.
You clinically check the patient, get the X-ray done. That is very important surveillance.
Hmm.
And chemotherapy again after surgery is required
Hmm.
for around 6 months duration. That is required, 6 to 9 months. Then what is again the relatives ask what is the prognosis of the patient.
Ah.
So very important. If child is less than 10 years, it's bit
Ah.
bad.
Ah.
More than 65, bit bad. High grade tumors, bit bad.
Uh-huh.
If it is spread to other parts of body, again bit bad for the
Definitely.
patient.
Definitely. Definitely. Yeah.
And we assess the chemotherapy response. Means the pathologist gives the histopathology report, and
Right.
if it necrosis is less, it's bit worse for the patient. Next is what is the survival? Again, very important question asked.
Yes. Yes.
So in oncology, it's always a 5 years survival that is calculated. So it's good survival if it's spread, not spread to any other parts of body. If
Okay.
it's spread to other
Definitely.
parts of body, it's bit bad.
Definitely. Definitely. Ah.
Yes. And complications, yes, all treatment has its complication. Chemotherapy has its own complication. Surgery has its complication like infection, implant failure, and this is the summary what is required. So you do two types of surgery. What is limb salvage?
Hmm.
Second is amputation.
Hmm.
Chemotherapy is required.
Hmm.
Before surgery, it's called neoadjuvant.
Yes.
After surgery, it's adjuvant.
Yes.
Radiation is not a treatment in osteosarcoma.
Okay.
And this at least the relative should know that if it's any pain or swelling around your knee,
Hmm.
shoulder,
Hmm.
consult your doctor.
Hmm.
You will get an X-ray done, MRI done, followed by biopsy,
Hmm.
followed by chemotherapy before surgery. Then surgery will be done, and at least they should know the prognosis of
Hmm.
this disease.
Hmm.
And good surveillance is required.
Yes. Okay. That was a very elaborate presentation. Now my couple of questions.
Yeah, no
Um,
problem.
what kind of complications during the chemotherapy possibilities?
So complications it can affect the heart of the patient. Most common cardiotoxic. So these
I see.
drugs are cardiotoxic.
I see.
So before chemotherapy, you get all the workup done,
Hmm.
2D echo is done, and the blood counts goes low due to chemotherapy. So neutropenia and other complications are there. So that should be taken care.
Oh,
So
oh,
you
oh.
require chemotherapy at a center where they can manage all these complications. So
Absolutely.
good center where you have good medical
All
oncologist and a good.
supplies are available.
So all things are available. You have ICU backup if required. That will be required.
Okay. And you told me the success rate and prognosis, both the things.
Yeah.
Uh, in girls' case, especially,
Yeah.
because now they will be in the puberty stage also, and they
Yes.
will have the other things also coming up.
Yes.
Will that affect?
No, that doesn't affect. So, if required, you can ask them for OM's preservation, that is asked by the medical oncologist, or sperm preservation, that is asked by the medical oncologist. That is again a common protocol. They will counsel the patient's relatives that that can be done, and ovaries transposition is also done by few people.
Hmm.
So that is also
How
required.
safe is that, doctor?
It is done. It is done formally. It is counseled and it is done because
Okay.
they are in the age group which in
Exactly.
future they will have fertility issues.
Exactly.
It needs to be counseled
Ah,
because it's these drugs are quite toxic drugs. It can affect all the
exactly.
important organs. So
Absolutely.
these need to be counseled. So teenage and young adult oncology is again a specialty.
Hmm.
Uh, so it is important to counsel them.
And very risky matter,
Because
definitely.
the age group is that they will not understand what is the
True.
advantage,
True.
disadvantage of the drugs, and they may leave the treatment in between. So you
Yes.
need to counsel them, show
Ah,
photos, videos of your old patients, ask them to meet them if possible. So we arrange sarcoma survivor program every year or in a few parts of the year, so that we counsel them and they can meet the original survivors, 5 years, 10 years survivors. So that can be done.
okay. Survival is 5 to 6 years, is it?
No, survival is good. Means If the tumor doesn't come after 5 years, it's very less likely it will come back again.
How
So
likely is not to come back?
I said 70% success rate, 70
Success
to
rate.
80.
Okay, okay. But somebody is unfortunate if they are not in that 70%,
Yeah, so that is beyond your control.
beyond your
Best
guess.
possible treatment is you do surgery, you give chemo, take in routine surveillance, but some things are beyond your control. So at present, that is the limitation of medical science, that you
Definitely,
can
definitely.
cure all of them. So in
Right,
future, you may have something breakthrough,
right.
you may have vaccines or other things, but currently nothing is available for these
Nothing.
tumors.
Okay, and now in case, okay, the treatment is going on parallelly and doctors are taking care of everything. But as a family or as a parent, what is that you would advise from the diet point of view and other things?
Diet should be, we advise good high protein diet to them, that
Okay.
they eat good high protein diet, because these drugs are quite toxic, so the body becomes quite weak. So good hydration, good water, fruits are given which are safe, and high protein diet we advise them, because protein levels goes less, then that will be a bit bad for their immunity,
So,
and wound
absolutely.
healing becomes a bit bad.
Yeah, and you also
So
said blood
diet
count also another area that.
is very important. Again, diet will not improve that, but still we can say good diet. We advise them and counsel them that keep regular follow up with the doctor.
Hmm.
Don't abandon the treatment in between.
Hmm, hmm, hmm,
Don't try to go to any other line of treatment. Bit difficult for management.
hmm,
We
hmm.
don't know the success rate with any other medications, any traditional medications,
True,
but
true.
we know the outcomes of standardized medications.
Yes.
So other traditional medications not that recommended.
Hmm,
They can try, but not recommended from our side. So
hmm,
follow what is standardized all over the world.
hmm.
That take proper chemotherapy, do surgery, whatever your doctor tells you.
Doctor has
Till the
prescribed, follow that
chemotherapy,
regime. Yes,
in, stay in regular follow-up. So loss to follow-up
that's
is
more
bit bad.
important.
Again,
That's
loss to follow-up is very common thing. The
correct.
patient doesn't come to you for 1 month, 2 months, 3 months. Multiple reasons are there.
Huh.
Economic, financial, any other things
Other
are there.
commitments. Yes, yes.
They think that patient will not get cured.
Hmm,
So we try to counsel them. We have special departments available at our
hmm,
center.
hmm,
Pain and palliative department is there.
hmm, hmm,
We'll take care of pain.
hmm,
So it's quite painful after surgery or before surgery.
hmm.
So we counsel them very properly. There are good counselors available at the centers. So again, they can take help of them. Very
And
important.
how about infection part? Do we really need to keep them
Yes, infection
isolation?
can occur during chemotherapy.
Huh?
Very high chances. Their immunity is low. After surgery, also chances of infection are there. The
Okay,
joint you have put and that may get infected. That can
okay,
occur. It
okay,
occurs in all our cases. So quite common risk for us.
okay. So, what is advisable? Isolation is the
Isolation, but they should take proper precautions, that use mask, take proper hygiene, and that things can be followed. Other things are difficult to achieve.
true, true. Okay, I think that was a really quick and very important discussion. Thank you very much, doctor. And it's a something which is becoming a high topic nowadays. And I was surprised to see that there are many cases like this available nowadays. So it was really worrying for me to know about it. Thank you, doctor. Thank you for your
Yeah,
time.
thank you very much. Thank you, ma'am. Thanks.
Namaste.